yourself in the chat. Put down if you're a student, if you're staff somewhere else, if you're at UIC or another university or an organization. I think we have some alumni and incoming students as well. So welcome all, and we'll get started in just a minute or two. Welcome everyone. Those who just joined, feel free to drop in the chat where you're from, why you're here, if you're excited to learn anything today. Nice to see you all. I know we've been having a good mix of folks from Chicago and other places in the country. So I love to see it and know where you are all coming from. Hello, everyone. Feel free to introduce yourselves in the chat. We're gonna get started. This session is being recorded, so if you would prefer for your face to not be visible, that is fine to leave your video off. This session will be is recorded and will be posted to the Epidemics of Injustice course page on the School Public Health's public site. And we will be spotlighting the speakers once they start speaking, so you can turn your camera on if you would like, and you won't be front and center if that makes you more comfortable. It's nice to see so many of you introducing yourselves in the chat, so keep on doing that. I wanted to just give a introduction about this course because I know we have some folks who are visiting or haven't attended any previous sessions. This course is Epidemics of Injustice, and it's an annual course. This is the 5th year of it running. The very first year of it being co-led by 2 doctoral students, which is me and Ms. Washika Torres, my co-instructor. And this course is free and open to the public. And our goal is to prepare public health leaders and community members with tools to bring about social change and address the structural determinants of health. So our theme this year is resistance, revolution through public health. And so each week we have a different set of speakers and a different topic, and each one is focusing on ways that we can engage with advocacy, revolution and rebellion through public health work. So we do have a couple more sessions coming up after this and future weeks, as well as all the recordings from previous sessions are available on the Epidemics of Injustice course page. And this course is sponsored by the Collaboratory for Health Justice, which sits in the UIC School of Public Health. So last week we had an action lab from Dr. Arden Handler, who is a professor in the Community Health Sciences Division here at the School of Public Health. That recording is available on the Epidemics of Injustice course page again. So I highly encourage you, if you're really interested in policymakers and that policymaking process and kind of the different theories related to that, definitely check out that action lab. And so last week we talked a lot about what the process looks like in terms of advocating to policymakers and the things that go into deciding what is the policy to advocate for and how do you actually go through that process. So this week we are kind of shifting our attention both to Chicago, but also learning from 2 wonderful people who are engaged in food policy action. So we have 2 representatives from CIFPAC who are coming to talk a little bit about their work and hopefully give us kind of more hands-on examples about what policy work looks like and how to be engaged in it. Before we get started, I just wanted to acknowledge the land that UIC sits on, and I live in Chicago, and if you live in Chicago, the land that you sit on. So I just want to acknowledge that we reside on traditional territories of the Three Fires people. And we recognize their current and previous and current struggles for self-determination and sovereignty. And I encourage you to check out all that's in this detailed land acknowledgement. It's a LibGuide from the USC library. And lastly, if you do enjoy this session, we are the Collaboratory for Health Justice has set up a fund to support this course and help make it great for future sessions and future semesters and more accessible for all. So with that, I will go ahead and turn it over to our speakers.
Great. Thank you so much, Alexis. And thanks, Vashika and Kelsey, for having us this evening. My name is Marley Wilson. I'm the Good Food Purchasing Project Manager at the Chicago Food Policy Action Council. I use she, her pronouns. And I'm here with Steph. Oh, Steph, say hello.
Yeah, my name is Steph Funk. I also work with the Chicago Food Policy Action Council. I'm a communications specialist and I use she, her pronouns too.
All right, I will get the screen share started here. We're gonna walk through a little bit of a background on the Chicago Food Policy Action Council first, and just give a brief overview of all of the ongoing work and a little bit of a history around the council. And then we'll do a deep dive dig into the Good Food Purchasing Policy and related initiative, and hopefully have plenty of time for questions and conversation from everyone in the audience. Really excited to see that folks are joining us from all across the country, and really interested to hear everyone's perspectives and voice in this conversation. So yeah, thank you all for being here. All right, let me share my screen. Go. Everybody see that okay?
Yeah, looks
right.
good.
Yeah, that's good.
All right, I'll turn it over to Steph.
Yeah, I'm going to quickly give an overview of CFPAC. So this is our beautiful opener, but we can go to the next slide. So CFPAC as an, oh, actually, Marley, maybe it's just my screen. Do other folks not see all of the PowerPoint?
Yeah, it seems kind of cut off.
It's really minor. If we can't figure it out, I think it's fine. Yeah, maybe redoing it. It started with the U and hour.
Love the technology.
Maybe try whole screen instead of one window. It's not a Zoom lecture without at least one tech issue. Okay, that looks perfect.
Perfect.
That's great. Okay, so we refer to the organization as CFPAC, but the long name is the Chicago Food Policy Action Council, which has been technically around for 20 years. We received nonprofit status not that long ago, but CFPAC was born out of the need for there to be a space for people to talk about food justice issues, and specifically advance policies related to food justice and food sovereignty in the Chicagoland area. So it started with our summit. We'll talk a little bit more about that later. This year was our 16th annual. I think we received nonprofit status in 2012, but technically CFPAC has been around since 2001. If we could go to the next slide. So as an organization, our mission is to co-develop, facilitate, advocate for, and support the implementation of policies that advance food justice and sovereignty across the Chicago region. CFPAC as an organization envisions a food system where all Chicagoans, regardless of race, class, gender, and/or social identity, have the right to healthy, culturally appropriate food produced through community-driven, ecologically regenerative, and economically viable processes. And additionally, the council recognizes the history and modern maintenance of structural racism in Chicago and across the country that have led to massive inequities in land access, food business ownership, food security, and political power along the lines of racial identity. And so CIFPAC as an organization works to address these inequities and dismantle racist structures in the food system by building local political power, supporting frontline workers throughout the food system, and facilitating BIPOC partnerships and understanding. Next slide, please, Marley. Awesome. And so here are 4 basic pillars of what we do. We mobilize networks and catalyze policy. We facilitate peer-to-peer knowledge sharing. We aim to create transparency in navigating systems, specifically when it comes to funding, and uplifting success stories and making sure that everyone has equitable access so that they can have their own success stories. Next slide, please. Awesome. And so here is a really quick outline of the initiatives we're going to cover today. This is not everything that CIFPAC is working on. It's not everything we've accomplished, but I am relatively new on staff. So this is the list of things that I'm really well versed on, and the things that we have been prioritizing in recent months. But of course, COVID has shifted a lot of our main initiatives, Gfpp, or the Good Food Purchasing Initiative, being one of them. But Marley will dive into that later. So if we could go to the next slide. So first, we just wrapped up our 16th annual Chicago Food Justice Summit. Just yesterday, we changed this slide. It used to be titled the Food Policy Summit. But one of the ways that CIFPAC is adapting to how folks are giving us feedback and the way that we run our programming is that the word policy can be kind of exclusionary or intimidating. And ultimately, as an organization, we're aiming to have Chicago be more in control of its food system. And so we don't want any of our events to appear as if people aren't welcome or their thoughts aren't worth sharing with the broader group, specifically because they don't have any policy experience. So we took some feedback from some of the folks in the planning committee and decided that the term food justice was more accessible and approachable to people and would more likely garner a broader audience and a more representative audience of what our food system actually is. So like I said, this was our 16th year, and it was also our first year doing it virtually, which provided a whole bunch of other barriers. But despite all of those changes, last year we had about 600 people register for the summit, and this year we had over 1,300, which is bananas. And I think a lot of that is because it's a virtual conference. Like, you're not limited to geography, anyone can attend. It was also spread across multiple days, so it's not as intense. People can come and go as they please. And then I'd also like to think that some of it has to do with the shift from policy to justice. But all of our sessions were recorded, which is another added benefit of having something be virtual. And so in the chat, I'm going to put our YouTube playlist. This has all of the summit sessions that aired in order too. So starting with the keynote. And I would encourage folks to browse through the materials that's there. And if you could go to the next slide, Marley. Cool. So another way that CIFPAC works to convene different audiences, it's getting so dark in my room, is our Urban Stewards Action Network, which is abbreviated to USAN. USAN is a space for BIPOC growers to connect with one another, resource and knowledge share, and also just create a space where they're able to thrive. According to the US Census, less than 5% of all of the nation's farmers identify as BIPOC. And that is not on accident. There are a lot of reasons why folks that are BIPOC have issues with accessing land, capital required to start a business. Farming isn't something that's like a get rich quick scheme. It's a really, really tight profit margin. So unless you're in a situation where land was granted to you in some way, or maybe you inherited a farm from someone, it's very difficult to start a profitable farm from the ground up. And then there are even more challenges presented when you're in an urban environment. Like, land is harder to access. The way that land is used in urban environments is kind of tricky, and maybe a really weird factory was burned down that had a ton of lead paint a really long time ago, and that means that you have to do a ton of remediation with soil. So this group meets once a month Anyone that identifies as BIPOC and as a grower is welcome to join. You can find a form on our website where you can put information in to gain access to those. But a couple different events they did pre-COVID were a Black and Brown and growers and gardeners exchange. And then also we hosted a few food funding Fridays, which was like a mini pitch contest where BIPOC growers could come, share their pitch, and compete for a small mini grant. I think it was $5,000. Next slide, please. Cool. And then our third example of CIFPAC convening folks is our COVID rapid response effort. This was actually the first project I participated in when I came on staff in March. Yep, in March when the shutdown started. Crazy to think it's been an anniversary. But a lot of us were all in the same boat of like, oh shoot, what are we gonna do? And so CIFPAC thought that given our mission and our position, we would be a good person to convene all of the relevant groups. So that way we could have everyone in the same room and address problems as they arose. Because back in March, none of us knew anything and we had no idea how long this was gonna last. I remember thinking that I would be out of my house by July. And here we are on the anniversary, still doing Zoom lectures. But over the course of its now year-long life, over 350 organizations have been involved in some way or another. And it has evolved into several different working spaces. We have 3 active working groups, one that's entitled Resilient Food Systems, where anyone that does any kind of food distribution, mutual aid networks, food banks, food distributors, some schools even, and then networks of volunteers will gather to brainstorm ways that we can make our food system more resilient to things like pandemics. The group was originally titled Emergency Food Access, but folks wanted to pivot since, of course, the pandemic is an emergency, but we know that emergencies happen. And so we should have a food system that accommodates for emergencies and has several different plans rather than being caught kind of empty-handed and then using that as an excuse to be careless or thoughtless with however plans roll out. So one big thing that groups focuses on is providing culturally appropriate meals to people, rejecting this charity model of like, I have a random food item and I give it to a random low-income person and that should make that person happy because that's just how it is. Like that's unacceptable. We can do better than that. Another group is supporting small businesses. So I don't know what the real numbers are at this point, but I've heard something like 20% of all small businesses don't exist anymore since the beginning of the pandemic. Which is awful. I think a lot of us share this fear of emerging out of the other side of the pandemic with the only companies being Google, Amazon, and Walmart. So that group focuses on funneling funding sources to small businesses, having folks band together. So like I said earlier, if anyone is facing some kind of issue, hopefully other groups or other people in the group can help or are facing the same issue and have some kind of advice or guidance. Or if none of the above is true, we could all work together to figure out what the best solution is for everyone. And then the third group is food chain workers. So making sure that the essential workers that are feeding us throughout this pandemic are properly cared for. And that group has been working on all sorts of stuff, but most recently making sure that warehouse workers have vaccine access. There's been a lot of data that shows like folks in the meatpacking industry have been really, really vulnerable to the pandemic. And our previous president seemed to show no empathy towards any of the issues that they were facing and was insisting that like production lines sped up and that basically acted as if there wasn't a pandemic and insisted that productivity and profit always took precedent over the people that were actually feeding us. And so those are 3 of the groups. And then the 4th group was this broader call, which we called the Rhizome call, because after the calls had happened for a little while, some folks expressed that they didn't have the capacity to attend several calls a week, but they were interested in what was happening in other groups. So we started this one giant call where anyone could come, like anyone on this call is welcome to join the next one. And we just run through updates from all of the groups. And usually we'll invite a speaker either from the group or from a nearby field to talk about the work that they're doing, share calls to action, or try to form some partnerships through that. And everything that gets shared on those calls ends up on our COVID directory. And so I haven't had time, we had a call today and I haven't had time to update it because Marley and I were preparing for meeting with you all. But here's our directory. It will be updated later today. And it goes through resources for farmers, resources for small businesses, food workers, funding sources, and then emerging best practices. Next slide, please, Marley. Awesome. And then another thing that CIFPAC has been working on, this is loosely around convening, is communications and digital advocacy. So I think this was an initiative before I started, but now, of course, with the pandemic and basically our whole world being virtual, this has been a really big push. We are activating and expanding our newsletter, which we restarted this year. We're trying to broaden our audience on social media, so that way, whenever there's urgent calls to action, we have like a large pool of people that are ready to go. And we are also doing some website updates, graphic design, and experimenting with virtual storytelling. Next slide, please. Cool. So one of CIFPAC's main initiatives is the Good Food Purchasing Program. This is encouraging institutions and city agencies to consider the procurement of their food. And I'm going to gloss over this one because Marley is going to spend a whole 30 minutes going really deep into it. And I'm really excited for it. If we could go to the next slide. Awesome. Another really cool initiative CIFPAC has been working on for a while is led by our colleague Miraj Sheikh. I'm going to put a link in the chat that describes more information, but it's called the Productive Landscapes Task Force. And so Miraj and a team of people are doing this huge lift of mapping out all of the available land in the Chicagoland area and doing some research into who owns it and what was done with the land previously. So earlier we briefly touched upon some of the barriers or issues that come with urban farming. So just because land is available doesn't mean that it's necessarily suitable for farmland. Not only could it be contaminated, maybe it doesn't get enough sun, maybe there's not enough space, maybe the soil doesn't have proper nutrients and it needs several years of restoration before food could be grown on it. So Miraj is working with this team of people to map out all of that space, figure out who owns it. So that again is another barrier. If somebody already owns it, it's possible that they're not interested in sharing it, or maybe the city owns it and there's like zoning restrictions as to what could be done with it. So they are mapping out what could be farmland, what could be ornamental cropland. Like if you walk down the Millennium Park area, some of the planters have like purple cabbage and kale in it. And technically we're not eating that. They're just meant to be ornamental plants, but they are food. Or it could even just be gardens. Like we could make the Monarch way stations or just pretty green spaces for people to enjoy that aren't empty parking lots or ditches like they are now. Next slide, please. Cool. And so this is a pretty new one. I'm going to put another link in the chat, but CIFPAC has been partnering with several organizations, mainly advocates for urban agriculture, in mapping out different pathways for water access for urban growers. Every year it changes, which is really unfortunate. That's another barrier to farming in an urban area. Water access always changes. So there's a couple different things here. One being the difference between a community garden and a farm. So if you're a festival and you want access to a water hydrant in Chicago, you have to pay something like $750 per day to unhook the hydrant. Community gardens get to skip that fee, but farms that are growing for production purposes, so that's the distinction between a community garden and a farm. A community garden is a community resource. It's not meant to make a profit off of. It's just a space where people can grow and explore. A farm is a business where there is some kind of profit model. And so if you are growing for profit, you cannot access a hydrant for free. And as of earlier in 2020, I think, the process to access a fire hydrant near you became really, really, really expensive and really, really complicated. So AUA, Advocates for Urban Agriculture, Neighbor Space, which is an organization that helps provide farmland for different farmers and organizations, and CIFPAC have been partnering on mapping out all of the possible ways that you could access water given your specific situation. And so I sat in on a call today where some of the options were you don't own your land, but you're on really good terms with your landlord, and perhaps you have an extra $40,000 lying around, which is how much it costs to install a water line to your farm. And maybe your landlord is cool with you doing that for the land, even though you're not an owner, which is uncommon, but it's possible. And so that's one way a farm could get water. Another one could be requesting that the city take off the cap on this fire hydrant. So I've heard in past years that there wasn't a giant screw on top and that anybody could just unhook a fire hydrant. But that's not true anymore. You have to request permission from the city to do that, and the city will come with like a giant tool, and they'll either give you the tool or they'll do it for you. But one of the tricky things is fire hydrants aren't actually labeled. So let's say I have a farm and there's a fire hydrant that's on the corner of my block, and it would be really handy if I could get permission from the city to use that fire hydrant water for my farm. It's very difficult to tell the city which specific fire hydrant would be the best for you to use. So all three of these groups are working with some lawyers to put together some language that the city agrees with and a process that allows you to efficiently tell the city which specific hydrant you need to get water access. And so the call I sat in was like, should we have people take a screenshot on Google, or should we have them like take a photo with their phone and make sure that the cross streets signs are visible? And to me, it sounded like maybe we should just number the fire hydrants for ease, but I didn't sound like that was a solution. But yeah, we're hoping to have this guide be available on all three of our websites as a flowchart. So you can come to the website and you will be presented with a landing page where it says like, I am ABC. And if you click on B, you go to the next spot where it's like, okay, 1, 2, 3. And then you click, 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 click until magically you have access to water, or you have all of the paperwork that you would need to submit to the city so that you can have access to water for this growing year. And again, one of the not super fun things about this is this process needs to be done almost every single year. Next slide, please. Okay, this is a fun victory. This is slightly in the past. In 2019, CIFPAC helped pass some legislation that meant that Illinois would legally recognize worker cooperatives as a business. And so I wasn't around for this, but it was a huge victory. CIFPAC played a really large role. But what I am around for is we now work with a lot of co-ops, which is really, really cool. This is really important, especially from a worker standpoint, because this legislation provides a clear path for workers to own a business and then consistently do so. So it provides protections for those workers. And if somebody wants to establish a co-op, they know that nothing is going to shift. Whatever policies they put in place for their specific co-op will remain in place and honored by the state and all corresponding legislation. Next slide, please. Awesome. Okay, and since part of this, this group is how people can get involved in local policy, I have a quick little action item if folks are willing. CIFPAC is working with the Illinois Stewardship Alliance to push forth the Home to Market Act. So this act would give cottage food vendors more avenues for potential sales for their products. So cottage food vendors are people that make some kind of food product in a home kitchen. And originally, or currently, cottage food vendors can sell at farmers markets. So wherever your local farmers market is, if you see somebody selling something like this, where it's like a meal in a mason jar, or maybe jams, some baked goods are examples, salsas, those are likely falling under cottage food vendors. They don't have all of the same restrictions as bigger businesses do, since they don't have the capacity to do things like that, but they get their recipes and some of their procedures approved by state or county agencies. And that's how they're able to provide a product and then sell it through a market. But when COVID hit and a lot of farmers markets were either on a hiatus or had a hard time opening, a lot of sources of income for vendors like this just suddenly halted because they're not eligible to sell that product virtually anywhere other than a farmer's market. So this act is aiming to expand sales avenues. And one of the really important selling points is a lot of these vendors are women and BIPOC people. And so ensuring that people have multiple ways to make revenue, especially in something like a pandemic, also with something as wholesome as wanting to feed your neighbors, we don't want to discourage that. We want to make sure that if somebody wants to put together a small home run business feeding the people in their community, that they have the ability to do that. And if their local farmers market closes, or if their area doesn't have a farmers market, that they're not totally unable to do that. And I think that might be my last slide, unless, yeah, okay. And then, so Marley and I thought we could take a brief pause for questions here before we dive deeper into good food, GFPP, good food purchasing stuff. Does anyone have any broader questions about CIFPAC as an organization, what we do. We'll also save questions for the end too. But if anybody needed any clarifying information.
I haven't seen anything in the chat. I've been following it and looking at all the links. We do have that really large question from the discussion board post, but I know we can kind of save that for a little later for y'all to think about, because it was a very long question. Someone wanted to know if you have a link to the bill, specific bill, because their family has beehives. Oh, that's so cool. And they've been hit hard by the pandemic. I recently found out that it's like, what is it, an apiary? Is that what it's called?
Yep.
Mm.
Yep. I will look it up. Oh, wait. Did I find it? Oh, I gotta look it up. But I'll put it in the chat when I find it.
Any other questions before we dig into this deep dive? Oh, awesome. Isaac, thank you for sharing the.
Yeah, I was gonna say so too, but I accidentally muted myself.
Great. So yeah, Steph, thank you for that really comprehensive overview of some of the current projects that CIFPAC is focusing on. We're a pretty small but mighty team at CIFPAC, and a lot of our work is done in partnership with other organizations that are working, fighting for change and fighting for a more just and equitable and sustainable food system. So I am going to pick up where Steph left off and dig in a little bit more deeply into the good food purchasing policy, just to kind of walk through an example of how an idea becomes a policy resolution, and then what happens after it passes, and dig into kind of where we're currently at with supporting the implementation of this public policy at the city and county level. So the good food purchasing policy emerged out of the Los Angeles Food Policy Council back in 2012. They developed this specifically for, the city of LA, and LA Unified School District is the largest purchaser of food within the city. And based on their initial success, they've actually, a group of former LA Food Policy Council folks spun out and created the National Center for Good Food Purchasing to support other jurisdictions and institutional entities across the country with implementing, passing good food purchasing policies and implementing them. So the main focus, the main goal of what I'll call GFPP quite frequently. So if you hear that acronym, I'm talking about the Good Food Purchasing Program. I'll try to stay away from as many acronyms as possible. But the goal of GFPP is to transform the way that public and community anchor institutions purchase food, so that we are creating a more transparent and equitable food system that's focused really around these 5 core values: local economies, nutrition, fair labor, animal welfare, and environmental sustainability. So we saw some of the initial success in Los Angeles, and this is before my time. I've been on with the Chicago Food Policy Action Council for 2 years, but back in 2015, a coalition of different organizations met at the Chicago Food Policy Summit at the time, and started to talk about, what if we could do a good food purchasing policy here? Obviously different geography, different opportunities, but there's a lot that folks saw that we could adapt from what the city of LA had been able to do. And so back in 2015, this coalition started to organize, and after a couple of years of building buy-in and investment from city officials, in June of 2017, the good food purchasing policy was adopted through the wellness policy for Chicago public schools. It was also adopted in a similar fashion for the Chicago Park District's summer food service program and after-school meals for kids. And then later that year in October, it was adopted as a resolution by the city council. And then in May 2018, the Cook County Board of Commissioners adopted the resolution. And we'll talk a little bit about how that came to be. So as I mentioned earlier, it was very much inspired by these initial wins in Los Angeles, but it also built off of existing efforts by champions within the city and county that were starting to talk about, how can our food purchasing dollars go towards the local economy, support equity and fairness in the food system, support a more sustainable food system. And so these conversations were already taking place to some extent. And this policy and its related programmatic framework really spoke to some of the desires of city officials and, obviously the community to move forward and set more tangible goals for change. And timing is everything. So back in 2015, there was an ongoing mayoral election between Rahm Emanuel and Chuy Garcia for Chicago mayor. And this GFPP coalition that formed was able to garner support from both candidates. And then Rahm Emanuel was elected to another term, and Chuy Garcia went back to his seat as a Cook County commissioner, which is in effect how we were able to adopt the policy both within the city and the county, and just speaks to, it's helpful to leverage electoral politics sometimes to create policy change. And then, ever since, we've been continuing to build buy-in and trust and build relationships with all of the departments and agencies that buy food for public meal programs or hold contracts with concessionaires, food vendors. And I think that relationship building and buy-in and trust is really key, and we'll keep talking about that throughout the presentation. So what do we mean when we mean public food? I just wanted to kind of go over currently who is covered by the good food purchasing policy in the city of Chicago. So we're talking about school meals, the National School Lunch Program that Chicago Public Schools runs. As I mentioned earlier, the summer and after school meals through the Chicago Park District. The Department of Family and Support Services does all the senior congregate meal sites across the city, as well as Meals on Wheels programs. And they also support the emergency food program with food pantries across the city in their network. Chicago City Colleges has, that's a public entity with a contract for their cafeterias. Department of Aviation has a contract for all of its concessions in O'Hare and Midway. Cultural fairs and special events puts on massive food festivals, usually every year, including the Taste of Chicago, which the city likes to hail as the largest food festival in the world. And then we have the Downtown Chicago Riverwalk. That's all public contracts with local restaurants mainly. And then the Department of Procurement purchases meals for the Chicago Police Department. Basically, for those who've been jailed overnight, they get a bologna sandwich. And the Chicago Housing Authority runs vending machines in all of their facilities. So this is a pretty extensive list of departments and agencies that touch food in some way and could have, immense buying power to reinvest that food into a more equitable and just food system. On the county side, it's a bit of a smaller number of institutions, but they have a significant impact in the community. So the Juvenile Temporary Detention Center, the Cook County Department of Corrections, so the jails, the health and hospital system, as well as vending and concessions in all of the Cook County owned buildings and facilities. And so we've been trying to really assess, like, what annually does this spend from across all of these agencies sum up to? And we know that there's upwards of $118 million spent on food between the city and county every year. And that number does not include the concessionaires that I mentioned. So we believe with the aviation and Riverwalk and other Taste of Chicago vendors, they're spending up to $300 million on food every year. And I just, imagine what even a percentage of that number shifted towards supporting community-driven businesses that are served by Chicago and Cook County's institutions. What could that look like? There's power there in their procurement dollars. So the Good Food Purchasing program that the Center for Good Food Purchasing has developed for those who have adopted the policy focuses around these 5 core values. And I'll get into a little bit more of how they're shaped. But essentially they set standards for every institution to meet target goals in nutrition, environmental sustainability, valued workforce, local economies, and environmental welfare. There have been a lot of efforts in silo from each other leading up to this point. So there's been a pretty robust call for local food spend in institutions, especially schools. You might have heard of like the farm to school movement. There's absolutely, the public health department has run nutrition focused goals in the past for city entities to, try to offer healthier meals throughout city and county environments. And there's been some climate change goals connected to the environmental sustainability piece, et cetera. So like a lot of this work has been happening, and the Good Food Purchasing program is trying to take a more holistic approach to these changes and recognizes that all of our struggles are connected, and we can make more progress if we all kind of work together across these different like lenses and perspectives. And often the strategies to meet environmental sustainability intersect quite well with animal welfare, that intersect quite well with nutrition. And these are all kind of, complementary towards creating a more just, equitable, healthy, sustainable food system. So how it works. First, we recognize we're not going to get to, for example, 100% organic food sourced from urban BIPOC growers tomorrow, but we're first kind of starting with where we're at. And that means that we need to collect purchasing data to understand what is being bought and served in every environment across the city and county. And then we turn that data over to the Center for Good Food Purchasing, and they assess, they do a baseline assessment basically of like where that particular agency or department is spending their money currently, what percentage and quality of their spend is reaching those standards in the 5 value categories. And then they are tasked with setting goals for themselves, and with the support of the center, with the support of the Chicago Food Policy Action Council and our partners in the Chicago Department of Public Health and Cook County Department of Public Health, creating an action plan to make change. And one of the most critical pieces of that action plan is changing solicitation language and requests for proposals for food businesses, so that when the city or county signs a new contract with a food service management company or food distributor, that contract is aligned with their GFPP goals and will support the purchasing shifts and food service environment shifts that they want to make. Super critical and challenging piece of this work. And then the other need is that we continue to collect this food purchasing data and see how purchases are changing over time so that we can track that progress towards the goals that are being set for them to make more and more headway towards the 5 value categories, five standards. And knowing that this is not a quick fix. This is work that's going to take a long time. We have to keep ourselves motivated and celebrate success where we can. Because this is steering a pretty massive ship in a different direction. So really trying to stay positive and also support some of the folks that are working for change in these massive systems, and banging their heads up against a wall in a lot of cases. So trying to support them and help them in any way we can, and also kind of lift them up, celebrate their successes. So there are these specific standards set for each value category, and these have been developed not just by the Center for Good Food Purchasing, but with input from organizations like ours and organizations all across the country that care about seeing food procurement change. And a lot of the standards are based on existing certification programs. So it's not requiring like a farm or a food business to get a new certification per se. But it goes on what existing certifications they may have. So for example, probably the easiest one to identify is like USDA organic. If a farm is USDA organic, that's going to count for the highest level of environmental sustainability in the way that the standards are currently written. And they are actually updating those standards regularly. Every 5 years, this group that the center works with gets back together and reassesses whether the standards are reflective of the current best practices and certifications available related to each of the value categories. There's also a lot of different strategies. It's not a one-size-fits-all program. There's a lot of different strategies to gain points. So for example, for animal welfare, an institution can choose to really focus on meat reduction and try to kind of get as close to offering a vegetarian or vegan tray as possible. Or they can focus on increasing spend in meat products that meet animal welfare standards. So you can see there's like different strategies that institutions can choose to take based on what their community wants and where they see what's feasible for them. And yeah, it's still, even though there's that flexibility, what's really great is that we have now a benchmark. Like we can say, oh, we have 6 points in the GFPP for this particular institution. Oh, look, like that institution across the country has 22 points, and 4 stars, and start to kind of create some healthy competition between institutions to reach higher and higher points, higher and higher star ratings in the good food standards. And what's also really nice is that now that we're kind of enrolled in the Good Food Purchasing Program, city and county departments and agencies are connecting with departments and agencies all across the country who are similarly going through the Good Food Purchasing Program and trying to make change to their food environments as well. So there's like a national peer-to-peer network of institutions talking with each other and approaching all of the barriers and opportunities together. And I'm realizing, I think I'm supposed to wrap up in like the next 10 minutes. So I will try to make it through with plenty of time for questions. Whew. All right. So just real quick, I'll share that I had mentioned at the beginning of my part of the presentation that the city of LA and specifically LA Unified School District had some really exciting early successes with implementing their good food purchasing policy. And we continue to be inspired by how much progress they've made. And, we realize that Chicago is a very different geography and environment than Southern California. But a lot of these things that we can similarly do here. Maybe we won't be able to shift 30 million into our local economy in the same period of time that they have, but I absolutely believe that we can do the same. We can meet the same goal. And they've also just had some really impressive wins in how much they've been able to reduce their carbon footprint, how they've been able to leverage the policy to support living wages and union contracts in their supply chain, as well as create healthier options and actually force the entire poultry industry to offer antibiotic-free chicken products. It's really based on their demands for an antibiotic-free product. Pretty amazing initial early wins. And we're not the only ones who've been impressed and inspired. There are coalitions all across the country that are working towards good food purchasing policies, or like us, have adopted our own policies. And we're in collaboration and communication with all of them. Just had a call organized by the Food Chain Workers Alliance earlier today, connecting with the coalitions across the country from Buffalo and Austin and Philadelphia. I feel like this map doesn't even have all of the pinpoints of communities that are involved, but it's a really exciting kind of snowballing policy across the country. And for folks that are calling in or listening in from elsewhere in the country, I'd be happy to connect you to the local leaders of, if you saw your spot on the map highlighted, would be happy to connect you to what's going on in your backyard. And if there isn't anything going on, there's opportunities to learn more on how you could help engage develop a GFPP coalition to make change. So here in the City of Chicago and Cook County, we have taken an approach to work collectively on policy implementation, not just with just the city or just the county. We're working together, and also have formed relationships with a group of academic researchers that are part of a consortium, kind of coalition that we run through CivPAC called the Midwest Consortium on Equity Research in Food Justice, MSERF. Sorry for all of the acronyms. And they're helping us to evaluate the impacts of the Good Food Purchasing Initiative. And we also engage good food task forces at the city and county level, who are comprised of the department and agency leaders that are kind of tasked with implementing procurement change, and also champions, supporters in the community that relate to the 5 value categories. So one of the reasons why we're all working together across the 2 jurisdictions is that we share a food shed. And what we've all recognized is that the policy implementation alone, creating demand for good food in institutional settings is not enough. This will not create all of the impacts that we're hoping to see of a more equitable and just local food system that provides good food for all. We need to take a little bit more of a holistic approach to making these shifts that addresses the supply side as well, and also normalizes values-based procurement, which right now we have an institutional food procurement food purchasing system that is designed to buy the cheapest, lowest priced food available. It is not designed for values-based procurement. So we really need to redesign it and really lift up and normalize a new model beyond just the public institutions that are covered by the policy. So the Good Food Purchasing Initiative works on 3 major objectives simultaneously. So we're trying to prove the model and continue to make progress with all of the city and county departments and agencies by implementing the policy, increasing the demand. But we're also working to foster a more racially and socially equitable food system that can actually meet that increased good food demand. If we aren't opening up the institutional food supply chain to more businesses owned by people of color in the communities that are served by constituents in the city of Chicago and Cook County, it's very likely that the good food demand that's being generated is going to profit the same companies that dominate the institutional food space. There are some major monopolies in the institutional food, and if we're not cognizant of that, if we're not actually actively trying to shift power dynamics and ownership in the food system, then I think we're just working at the margins. That we're just at the beginning of this journey, but we've really acknowledged we can't just increase demand. We have to work on supply chain development. And we also need to be talking to other community anchor institutions in the Chicago region, hospitals. We need to be talking to universities, colleges, and cultural institutions, places where these anchors that we call them in our community buy an awful lot of food and could be joining us in this initiative. So we're working on a lot of different fronts. This is a pretty big undertaking. And right now we're kind of in the midst of baseline assessments with departments and agencies, goal setting, starting to make actionable shifts in contracts and food purchases with departments and agencies. We've also CivPAC hired a supply chain development specialist to organize, really opening up this institutional market channel to more local BIPOC owned food producers and food businesses. And Dakari is awesome and would be happy to connect him to any of the folks on the line that are interested to learn more about the ongoing work there. And then we are talking about, how are constituents engaged in this, how are constituents leading this work and advocating for where they want to see change and how the strategy. So we've been talking to starting to kind of plan out how are we going to engage meal recipients, also staff who work in cafeterias and who work all across the food supply chain in GFPI as well, the Good Food Purchasing Initiative as well. Talking to other hospitals, colleges, other institutions too about joining us in policy adoption and into the broader initiative. And we're working on legislation aligned with GFPP at the state level, which I am going to run out of time to talk about. I'm so sorry that I'm running a little behind. I just have 2 more slides, I think, so almost done. I just wanted to highlight that we see Chicago on the ground as sort of this living laboratory where different institutions from different sectors, from healthcare sector, from higher ed, from K-12 environments, are all joining together and setting shared goals and a shared vision around the kind of food system that they want to invest in. And there's a group of national organizations that are trying to align their work namely Healthcare Without Harm, Real Food Challenge, which works with higher ed institutions, and the Center for Good Food Purchasing. And we're kind of working with all of those anchors in action, as they call themselves, to really see what this like alignment and vision could look like in a geographic region, in a place-based approach. So really excited about, our partnership with these national organizations, and also, what this can look like with collaboration on the ground. Okay, so everyone on this call can get involved with this work, and we need you to. And actually, public health professionals and students have been on the front lines leading the organizing, leading the advocacy around good food purchasing policies. So all of you are engaged in one way or another in a community anchor institution, whether you go to UIC or whether you are planning for a career in public health that will lead you to work for a city or county government, or you're planning a career that will lead you to work in a health or healthcare facility or hospital environment. That is an intervention point. You could make change to the policy of the institution that you are a member of, and we'd love to support you with that, and work together on building more good food purchasing champions all across these institutions. And I just wanted to plug like two specific things, two next steps. Join our monthly newsletter to stay engaged. Steph puts that together every month, and it's amazing and beautiful and full of great tangible action items and events, and hopefully in-person events in the future. And then we do have a GFPP coalition sign up, and are hoping to kind of activate that coalition a little bit more. I mentioned that we have some state level legislation in the works to create a good food task force for Illinois, and we'll need folks to be contacting their representatives and advocating for this resolution to be passed. So certainly some more advocacy work there. And with that, I am over time and apologize for that, but really want to express my appreciation and gratitude to everyone on the line for it looks like engaging really actively in the chat this whole time, and I feel like there's a lot of questions that I want to read through and answer, but I don't know if Washika, you saw anything that we should try to address first.
Well, I was able to copy and paste the questions in kind of like the order we got them. So whatever questions we didn't get to, we can just send them to y'all to answer, and then we can maybe post it on the discussion board. Because it was a lot of stuff, and then the students got really, especially with the questions, got really active toward the end. But also we do have a copy of the chat that is provided on Blackboard afterwards as a form of access. So it's really good. So let me get to the questions. Some of them are like multi-layered, so I want to get to them. So the first one was the CIFPAC Good Food Purchasing Initiative Evaluation Framework led me to wonder how the model interacts with programs like WIC and SNAP. The GFPPI gets to the root causes of affordable food access, unlike WIC and SNAP, which are just Band-Aids. Since the key objectives of the GFPI seek to the initiative in the city of Chicago and Cook County departments, agencies, and institutions, are WIC clients part of this? DHS oversees WIC in Illinois on a state level, but can county and local officials be engaged with this? WIC and SNAP WIC and SNAP programs are virtually important short-term ways to get people connected to food, but they are flawed and paternalistic. Can this model be used to improve those programs with the hope that eventually one day we won't need them?
Damn, that is a great question and a big one. I think part of the statewide legislation that we're currently advocating for, this development of a good food task force at the state level that would explore all of the ways in which the state of Illinois purchases food itself, but also passes through dollars for meal programs and food, could be an avenue for engaging WIC and SNAP programs more directly. Yeah, it definitely is somewhat connected to WIC and SNAP, but we haven't, well, actually, let me backtrack a little bit, because I think the most direct connection is through the Chicago Department of Family and Support Services, which runs the Emergency Food Assistance Program with the city. And they are providing meals to food pantries, and actually have a contract. I think I saw a question about how we were engaging with the Greater Chicago Food Depository. They have a contract with GCFD, with the Greater Chicago, our local food bank, if you're coming from out of state to listen in tonight. And the food bank actually delivers, distributes produce and other foodstuffs to food pantries all across the city. And, so there's definitely some like engagement in the emergency food system through that. I mean, it's not directly connected to like SNAP use in directly, but like certainly it's in the sphere, in the realm. I do think that, the goal of the Good Food Purchasing Initiative is to develop like food systems resilience and community resilience that where we acknowledge that living wages and like everyone's right to shelter and food and basic needs should be met, and that we shouldn't, have people that can't work enough hours in the day at the wages they make to afford enough food for their families and themselves. And so, we really are trying, I know the buzzword in public health is like the social determinants of health. How are we actually addressing with the way in which our public institutions and our community anchor institutions invest in communities to create more opportunities for resilience and for for us to be able to, as you're, asking in this question, like be able to phase out these Band-Aid approaches while recognizing that in the short term, we absolutely need to support and lift up WIC and SNAP programs, because they are so essential and reach more folks in need than any emergency, food bank does, and really are just critical to food access, food security in our country. Yeah, hopefully that was a semi-decent answer response. A lot more to share, but anything else, Steph, that you would add to that?
I thought that was a great answer.
Yeah. So the next question is also a little long. So concerning the Good Food Purchasing Program, I'm interested to know how they've partnered with urban farmers. A barrier that is stated is that there's limited land access for urban and peri-urban food producers. I'm stealing that word, peri-urban, by the way. I know that land is expensive in Chicago, and I do not know the empty lot statistics, but has the Chicago Good Food Task Force or other organizations considered using empty lots for the community? So this was answered a little bit, but if anyone wants to go further in, would the city allow empty lots to be used as community gardens with little to no fee? I'm not familiar with the Chicago policy, but in Detroit, there are a lot of empty lots that the city has allowed to be used as community gardens, and there are Detroit organizations trying to increase urban farming by utilizing the empty lots.
Yeah, we have similar programs in Chicago so that community members can access empty lots for community gardening and other purposes. And yes, we need more of that, and more, definitely connecting folks to, a lot of those are like less than an acre. So they can grow a ton of food, but for an institution that you would need to, be growing food on a lot of different plots. And then really the question then becomes, how are you creating the logistics so that multiple farmers could, potentially be in cooperation, in a cooperative structure with each other, aggregating product. So let's say like there's 5 farmers and they all grow spinach. Could they combine their volumes to meet the demand of an institution that maybe needs more spinach than one can offer. So we are thinking, we actually have an ongoing food hub feasibility study, which are some professors at the Illinois Institute of Technology have been focused on over the last year, of like really looking at, are there strategies for BIPOC owned food hubs, aggregation points or warehousing points where multiple farmers in urban growers and peri-urban growers who maybe have access to larger plots of land could can work with each other to fill the needs of larger purchases. And then something else I'm really, really interested in is like, how could we actually redesign the ways in which institutions buy food to open up more opportunities for smaller volumes, to, build more like very intimate relationships and connections between a cafeteria site and a local grower. And, there other places across the country have created a lot of innovations in redesigning systems to think through, it's not just about scaling up for these giant institutions, but it's also thinking like, hey, could we redesign the way in which CPS buys food, the Chicago Public Schools buys food, so that there's access, that these markets are actually like a little bit more accessible to a small or mid-sized farmer. So some really interesting design questions and redesign questions there, but yeah.
Okay, so we have time for one more question, and then we can send you the rest of the questions and you can answer which ones you wish, and we can put them on the discussion board for students. I actually thought this was really interesting. How has your ethnic or gender identity shaped your role in community organizing, your perspectives on the job, and influenced your passion for food policies?
Yeah, that's a great question. Yeah, because all of this work is political and personal, right? And I think for me, I'm definitely I'm a child of organizers and activists, and I saw just getting into food as this like intersectional lens to address like so much of the social inequity that we see, and that's very deeply personal work, because we're all part of this food system. We all eat. So many of us are growers, and it's just it's extremely personal, because what we have access to is the result of all of these systems and structures that have been built on really on the foundation of exploitation and disenfranchisement in our the founding history of our country. So we all have to grapple with that. And as a person that identifies as white, like I have a very active role to play in dismantling white systems of white supremacy that have structured our food system and continue to structure our food system. So it's deeply personal work. I'm also Jewish, and I grew up with some extremely rich Jewish traditions, mainly through eating and food and gathering and celebration. And that's like absolutely guided my direction in this work. Also just a need to address social justice like through food, which is something that's kind of, I think, very kind of deeply connected to my heritage, and I won't go so far to say faith, but definitely my heritage. But Steph, I don't know if you want to share anything else on that.
Yeah, I can share really quickly. So I am multicultural, I'm multiracial. My mom is Filipino and Chinese, and my dad his parents were from Yugoslavia, and so we think they're Romanian, maybe Austrian, maybe German. But I speak both English and German. I speak some Spanish too, and so being multicultural has been really interesting in this line of work. I think that from a really young age, I've been able to consider just a lot of different factors, being forced to as a kid. And even before I had words for race or inequity, there was a really stark power imbalance between my parents. My mom was undocumented until I was well into high school, and my dad is pretty outwardly racist. Like if my Filipino family came to visit, he would say like the monkeys are coming and like all kinds of awful stuff like that. And my white side really didn't like the brown side. The brown side didn't really like the white side either, but we all bonded over food. And it wasn't necessarily at the same table, but food is something that is so essential to the lives of everyone. And despite whatever differences or hangups you have about anything, at the end of the day, we all need to eat something. So like my white grandma taught me how to grow food, and one of my most consistent chores growing up was like making rice. And so my mom taught me how to make really good rice. And food has always been something that's been so special to me. And then also growing up in an urban environment, I was born in Joliet, but I moved to Chicago when I was 6. I took food for granted for a really long time. Food was either there or it wasn't. No one in my family was a really big cook. We were huge fans of Joyees. We would buy like a lot of food from Joyees and we would save it for the week. And I'm really good at like mashing together leftovers and making cool meals. But I never really considered who grew my food, where that was coming from, what those people went through, or even like the nutritional value of food. Food was like an enemy in a lot of ways. It was just this really complicated thing. And it wasn't until I was in college, I went to Costa Rica and I lived on a farm. And so 4,000 miles away from home was the first time I looked someone in the face and was like, thank you for growing my food. This takes so much energy and knowledge and effort. And I don't know how any of this works. And so I was really excited to come back home because I thought that no one else in Chicago knew anything about food. And I was going to be this like awesome 20-year-old visionary. And I get back home and of course, like so many people are already working on this. And yeah, just being introduced to food, or just how food was grown later in life, made me really passionate about including more urban people in this work, or just generally appreciating how much effort goes into the lifestyle that we have here in Chicago. But yeah, I'll leave it there.
Wow, that was a lot. Thank you both for sharing. I have 6 more questions in the doc. So did you want to go to 7? We can, but it's of course up to you. If you wanted to go to 7, so we can get some more questions in.
I can hang out.
Okay.
But if you want to go, Marley, that's fine too.
I'm down for one more. If the audience is with us and wants to stick around, I'm here.
Awesome. So this one's a little bit long. The other ones are a little short, but this one's also a little long. So this is a question for the end of the presentation, which is obviously where we're at. Food deserts and child obesity are often hot topics in the public health field, at least from my experience as an MPH student. There are, of course, important issues, but I'm wondering if you can share other ways public health professionals can be useful to the food justice movement. Your work with CCDPH and CDPH was a great example and something I hadn't considered as a potential collaboration between a health department and food justice advocates.
So the question is like, how can public health and food justice advocates, like what are other examples of ways in which they can work together, maybe beyond the trope of food deserts, food access? Is that?
Yeah, so within that vein of, there's a lot of food deserts and child obesity issues, and how can MPH students, either at the student level or once they graduate, how can they be involved with activists in these kinds of spaces that you had mentioned before, on these collaboratories and such?
Yeah, really good question. I think my immediate response is just the importance of broadening the lens from an issue of food access to really questioning, like, why do we have food apartheid, which is, I think, can drop some links in the chat. I think Karen Washington, as an activist in New York City, has really vocalize that term about food apartheid, that this is a socially constructed phenomena. Like it's no accident that certain communities are flooded with options for healthy, culturally appropriate food, and then, you know, based on race and class, there are communities that do not have access. And just recognizing, you know, using a term that really recognizes that that's not a natural occurrence like a desert, which is actually, you know, full of life and a very rich ecosystem. So let's not put down deserts either. But anyways, I think it's really about zooming out and thinking about the why. Why do we have issues of food access at all? What are the underlying economic and racist structures, institutions that have created this inequity in the first place? And then, you know, how do we actually, between public health and food justice advocates, like call for a community-driven food system where community members are, you know, really calling for food sovereignty and control over the food system, that it's not just controlled by a very few number of corporations that dictate how we eat and what we eat, but that there's, you know, a lot more kind of democratic control and participatory control over, you know, what is grown, where it's grown, how it's grown, and who has access to it. Steph, you have anything else you're thinking about?
Yeah, for this one I do. So my mom has worked at a hospital in Englewood for close to 30 years, somewhere between 25 and 30 years. And something she talks about all the time is how quick her colleagues are to prescribe medication to something that could be remediated with a lifestyle or diet change. And for folks that aren't from Chicago, Englewood is a predominantly Black neighborhood. And so her entire patient base is BIPOC. Like I grew up in the hospital all the time with her, and I don't think I've ever seen a white person that wasn't a doctor in that hospital. And it's so frustrating to see the difference in care that people receive based on class or race. And again, like when people come in with diet related illnesses, to just carelessly give them some kind of medication doesn't actually fix the problem. And in a lot of cases, because there's so many side effects with medication, it could make things a lot worse before it makes anything better. So everything Marley said, of course, but then also if you do decide to go into some kind of healthcare, yeah, she works at St. Bernard on 63rd and Yale. But yeah, just encouraging people to consider food as medicine, or at least lifestyle and diet changes as a viable alternative to prescribing medication.
I actually did want to insert that that's why there are some people who are pursuing DOs, which is like a doctor of, I'm really bad with what the O is, but it's like a holistic methodology of doctors. And there's only like one doing family medicine in the UI health system that I could find that took my insurance, just FYI, if you're looking for one. Thank you, Patrick. Yeah, I found like one who was a resident decided to stay. So thanks for staying. But yeah, so, and I have a friend who actually also does that as well, and they are looking at these kind of alternatives. And if anyone is interested, I'll try and find the piece. There is kind of documented things about this over kind of medicalization or operations as opposed to holistic approaches. So that's also true. Oh my goodness, I was supposed to read the next question and I muted myself while I was trying to. So they said, what degree do there exist food producers locally who are meeting certain standards? What's preventing the city of Chicago and other entities from purchasing food from people who are meeting, you know, small farmers who are meeting the good purchasing standards? Is it a matter of volume or something like that? Is there an increased cost?
Yeah, that cost piece. Let's talk about that. Yeah, I mean, you know, our public institutions have some tight budgets and they just keep shrinking. They keep getting smaller for food service meal programs. They're not seen as valuable. Whenever we talk about the good food purchasing policy with a finance director or, you know, someone that that has the power to pass this policy, the first question they ask is it going to increase costs? And we know that good food should cost more. Like, we should be paying farmers more money so that they can sustain themselves and sustain their communities, pay their workers, their farm workers, living wages. And we know that we externalize a lot of the costs of food that's cheap, when an institution or, when we buy food, we're not actually paying the full price of, that we pay as taxpayers later down the line, that we'll be paying, our future generations will be paying for through the, damaging effects of our industrial ag system on the environment. And yeah, so yeah, we should be paying more, but we can't really lead with that if we're going to try to pass policy. So we have to get really creative, and there's a whole bunch of really innovative strategies that institutions have used to actually keep costs neutral or even lower the cost of their programs by addressing food waste and trying to reduce food waste so they're not, spending a lot of money on food they never even use. And then also this whole strategy of less meat, better meat. So really thinking about how can we use less expensive plant-based proteins, legumes mostly. We're talking about whole proteins, not really Impossible Burgers or anything. Just thinking about all of the wonderful protein sources that vegetables provide that are a little bit less expensive than buying red meat. So just creative cost accounting, and then I think eventually it's we've got to advocate for federal farm bill and food policy that is aligned with our values-based procurement goals, because we're only going to get so far if our farm policy incentivizes the overproduction of certain commodities at the expense of human health. So absolutely a challenge, though. huge challenge. What are we going to do? We want to change these environments, but yeah, it's going to take us a long time to really build meal programs that are budgeted appropriately for making that change. I think the more evidence we have that hey, investing in community-driven food businesses in the neighborhoods where you're serving constituents actually can lower overall costs for your institution to run. So try to think more holistically around this, but that's it's difficult to build that evidence base and make that argument for finance directors.
If I could offer a really quick story too. Before my time with CFPAC, I managed farmers markets, and we had one meat vendor that would sell 1 pound of bacon for almost $15. It was really high quality bacon, but that is very expensive. And so people would always comment on it. And something I would always hear him say was, if your food is inexpensive, that means someone else is paying for it. And sometimes, like Marley says, it's subsidies, but in other cases, it's poor labor practices and unfair wages. Or if fast food examples, sometimes it's your health, your actual well-being. And that's something that I think about probably every day. When I go to the grocery store and I see cheap food, I try to imagine who is paying for that instead of me.
We only have about 1 minute left, but I did want to actually plug this thing for people who do use links. And I know you mentioned farmers markets. There's a program called Link Match, which does help to stretch your link dollars. You can look that up. I also know that, a lot of farmers markets are not open right now, but there are other places besides farmers markets. The only one place I know 100% that does it is called the Dill Pickle Food Co-op. I actually found it by mistake. I got lost meeting a friend, and that's how I found it. And then I saw that they did the Link Match program, which is a grant that the business has to apply for. But pretty much what it does is it usually they do it up to a certain percent in your purchase. It kind of doubles your link money if you are using Link. I know there's a lot of people who don't. There's some people who do, but that was something. Yeah, so yeah, it would be great if we can send a document to, we can try and work on sending a document with all the links that you all mentioned in the chat. to all participants. But yeah, so I've never actually been inside. I didn't go inside because I was actually going somewhere else, but I did notice I actually have a big sign there that lets people know. And I thought that was actually really welcoming, as opposed to me having to ask, do y'all take link? Yes, no, do y'all take? Because all I got is link. I don't get paid till next week. I need food now though. So so that would be really good. So we will definitely try and put those things in. I will also just type in link method.
Yeah, in response to that question, I can't speak to whether or not CIFPAC was a part of the adoption, but as a previous farmers market manager, I can say it's an interesting example of a policy that was super well intentioned, but on the ground did not roll out that well. Kind of like what Shika was saying, like as a man, so all of the markets are different. All of the currency is different. Sometimes it's paper money, sometimes it's tokens. It's always different colors. Some of them are interchangeable. Some of them totally aren't. Some markets only are for fresh fruits and vegetables. Some markets you can buy anything. Some markets it's double. Some markets it's triple. And it became really confusing and difficult to explain to people how the program worked. And even aside from that, if I explained it to you and you wanted to participate, I gave you fake Monopoly money. And so then when you spent your fake Monopoly money, everyone that saw you do that knew you were low income. And so not only was it difficult to explain the first time, but if you came once, it was very unlikely that you came again. So we are working with some folks to broaden the scope of the program and make it more easy to use. But it's federal funding. And so that's also tricky. Like a lot of the markets that have really restrictive policies, it's not by choice. The money that they get is really, really restrictive. But yeah, it's definitely something that we're thinking about.
But also part of it is really trying to destigmatize the use of stamps. And I've actually spoken to people about it, and they don't, I think unless you experience that stigma, it's hard to explain it. So even different supermarkets decide what they'll take in terms of link and what they won't take in certain policies. So it can get complex, but I think that, it's still worth letting people know, because, fruits and vegetables, like my family did not grow up eating a lot of fresh fruits and vegetables. It was mostly canned or frozen. So now that I do, when I'm learning spinach goes bad in a week, you got to throw it out. But also I'm, learning how do I navigate this food system on this graduate student budget. So it's 7:02. I will send you a message with the rest of the questions. The ones that you answered will be in red, and then the other ones will be in black. And like we said, we will also post links. We'll have probably like a doc where we can post links for all the students to kind of see them together. But yes, thank you both for coming. This was amazing. I think we had a great time, and we've really learned a lot about food and really investigating, but also investing in food for ourselves and our communities.
Yes, thank you so much. I'm gonna throw up a slide here for folks. Can folks see this? Let me try this again. I always get anxious about sharing my screen. It's never perfect. Again, if folks are loving this course, appreciating our speakers, we want to be able to compensate all of our wonderful guest speakers. So if that's something you are ever so moved to do, feel free to go to the Collaborative for Health Justice's page. And I just want to put a plug for our future sessions happening this semester. Next week, our topic is Art for Advocacy. We will be hearing from 3 wonderful people from the Disability and Human Development Department here at UIC. And then we have some other events, some other sessions coming up later this semester. So definitely check out the registration links for that so you do not miss it. And with that, thank you so much, Marley and Steph. It's been such a pleasure to hear about the work you do and CIFPAC and just learning from your wealth of experience and knowledge.
Thanks for having us.
So with that, thank you. I see all the wonderful messages in the chat. So now we'll take a break for the students who are registered for the class, and we'll go on to our discussion for the registered students. All else, you're free to log off. If you're an incoming student or prospective student, feel free to message me if you'd like to stay on, just so we know who you are. Thanks, everyone. The registered students come back at 7:10. Hello, everyone. Nice to see you all, or some of you anyways.
I now have to put my headphones on because the heat, the sound of the heater is too high.
Okay, welcome to week 9. We are over halfway there. Really? Yes. Okay. The semester's going by so quickly. We wanted to start with a couple of announcements before we just hop into our discussion / debrief. We've decided to extend the deadline for the book report, just in recognition that life is crazy. Life is crazy, the semester's crazy, and I think a lot of people are feeling kind of overwhelmed by the work and balancing everything. So we have pushed back the deadline for the book report. So if you have it done, feel free to go ahead and submit it and we'll grade it over break. But we wanted to give some more space so that you can, really spend time reading your books and being prepared, feeling more prepared for when we do have the book group discussions once we come back for spring break. So feel free to do that. And again, the rubric is on Blackboard. So we're looking forward to learning from you what you learned from the books. And we also just wanted to give you like a little reminder / prepare your minds for next week. Instead of the journal, so you do have a journal for today's class due next week as usual, but next week instead of the journal you'll have the art as advocacy assignment. So the assignment description for that is on Blackboard and posted in the week 10 folder for next week. So you can take a look at that, and if you have any questions you can send us a note before class and we can kind of clarify any questions before class. So I think with that, does anyone have questions about like class logistics before we dive into discussion?
Yeah, I actually do. I was just wondering, because I mean, I see a lot of our assignments are like, marks completed or however, but is the grading, is this pass fail or is it letter grade? Because I'm trying to see which way it's going, based off of, the way it was registered and the way the grading is going so far. If you could just clarify that part for me, that'd be great.
Yeah, definitely. And we have the syllabus is up to date with the percentages of everything, but is a like traditional letter grade. I'm not sure if Ms. Torres, if the university is doing like, different grading options as they did for like the fall. Or that might be something they're deciding to announce like, closer to finals because they like to do that.
They haven't yet, because I have been also looking for my students. But I think what LaShonda's referring to is because it's just a check or no check. So what we're pretty much doing is, if you've done the assignment comprehensively, you just get a check. And what it is, it's based on the amount that you've done. So if you only did like 3 out of 14 journals, of course, you're not going to get the percentage mark for that section. But if you've done, 14 or 13 out of the journals, and you're fine in that area. So although you're not necessarily seeing A, B, or C, we're really looking at how you've understood the material and things like that. So, and also if you've explained it adequately. So that's kind of possibly why you're thinking it's pass fail, but it's not. So what we'll do is we'll look at the percentages of like what you did in terms of the
number of journals.
Exactly, in terms of the journals, in terms of so everything that has like a check or something like that, that's not a number thing, is based on how much of those you've done. For the event, it's something similar. You've either done it and explained it adequately, or you haven't. Yeah, so if things are marked as complete, then yeah, it's pretty much 100. And because everyone is going to absorb and explain information differently. So we're not doing like, okay, well, you explained this, but you only got to see, like, you either did it or you didn't. And you either explained it adequately or you didn't, based on, well, the book reports, the engagement activity events, the event is also check, not check. I don't remember the book report one. But yeah, so the activity is also marked as complete. The journal entries are marked as complete, but I don't remember the book report one specifically, but that's based on a rubric. So
yeah, so for the book
that'll-
report, we have a rubric, and the rubric is designed in terms of content. So we're not grading things like grammar, because
Yeah.
why? It's about what you get from the experience and the information. So if you take a look at that rubric, it's really content based. So it's just like, you know, did you hit these points? And I think there's four or five categories.
Yeah.
So if you just use that to do your book report, you should get 100% on it. We really want to focus on, you know, the experience of the course and what you gain from it, and not be sticklers on how well you write. As long as your ideas are, as long as we understand what you're saying or trying to say, you should do just fine on the assignment.
Also, if you wanted to you could always meet with us, you know, for our office hours, or email us. So we can definitely have this conversation over email. If you want to have a more private conversation, that's fine. And then we can kind of look at things and speak about where you're at. Because I usually do my grades on Friday, so my half of the kids they get done on Friday. But yeah, so it's so that's kind of where you are. So as long as you've been kind of following along, you should be fine, right? In terms of like, how am I managing? So if you're getting your work in and it's not a 0, then you're doing fine. Let me see. And if you know you need any kind of extra guidance or help, or maybe something's not explained well, you can also reach out to us. So that's kind of that as well. The Art for Advocacy assignment is due April 1st.
We put on the on Blackboard 3/29. So that'll be the
Monday.
Yeah,
Monday, yeah.
that'll be on a Monday.
Yeah.
So you will have, so over spring break, we're hoping you'll have like time to get everything done. Yeah, and Shannon, you can resubmit your outside event if you'd like. Yeah. Any other logistical questions? And there's a lot of information we like kind of throw at you. Okay, yeah, and like Ms. Torres said, feel free to email us if you have questions. We have office hours and time blocked out for you all. So let us know if there's anything we can do to communicate better or clarify. I'll say this is my first time doing this course. You know, my first time taking the lead on any course, and definitely our first time on this particular course. So we're you know, flexible.
Very much so. Yeah.
All right. So we do have a couple of things posted to the discussion board, but I kind of wanted to just open it up for folks if you have any things you'd like to share based on the top or based on the readings. This is our time for the next 12 minutes, I guess. And as always, you're welcome to stay on and keep talking if it gets so tantalizing of a discussion.
I think this is a really interesting, I mean, both questions are really interesting. Let me not play. But does anyone want to kind of tackle the first question? I think it's really,
Yeah, I think this first question, I didn't put whose names these were, but I think this is in regards to that, the school nutrition policy paper of talking about, you know, last week we talked about different strategies towards policy making, and that paper provided like a really good example of how people respond to particular strategies. And yeah, so I really like this question of like, how do people respond to different kinds of strategies, right? And so last week we talked about knowing your audience, knowing what appeals to them. So whether that's a moral argument or a financial argument, economic argument. Yeah, so I think it really connects to that of thinking about the individual policymaker as well as, you know, yeah, the party's base, like what appeals to them, which is, I think, an unfortunate reality of the way our political systems are structured. yeah, does anyone else have like any thoughts on that first question there?
So maybe I missed this in the article, but were the strategies geared towards specific political parties? I thought it was just kind of like a pro school lunch versus like an anti. But was it like Republican versus Democrat? That
They didn't clearly outline that in the article, which I thought was I feel like there's probably reasoning behind that. So in the article, yeah, they talked about the pro versus cons, but they did talk a little bit about how that aligned with the channels of communications. They talked about how I think one of the examples was like this hashtag thanks Michelle Obama, or like teenagers on Twitter who were like mad that their food sucked.
Right.
So like thinking about that as is that a stakeholder group for a policy that is like, you know, worth maybe changing some communications for? Versus they talked about, I think they had different news sources. So I think they had Fox, CBS, and should definitely have it up, and a third one. And so they looked at you know, what were if there were any kinds of patterns related to that. Let me see if I can find this whole thing. Let me stop sharing my screen.
because like I thought that they were pretty equally developed across different political spectrum. When I looked at the mass media, like CNN tends to be more liberal perspective, where Fox tends to be more of a conservative perspective. And like the Michelle Obama hashtag thing kind of to me was like, you know, when a teenager's mad at their mom because they won't get pizza, you know, and it's Friday, you know, and like Michelle Obama's like the nation's mom kind of deal.
Mm.
But that's how I read it. I
See,
was just wondering if
I see. I
something.
thought the responses or the quotes that they chose from the media outlets seemed very conservative. Like, of course, the media outlets were kind of across all political aspects, but the specific quotes from all of the outlets seemed very skewed to me. And it kind of painted this picture that it made it look like it was kind of even Stevens. You know, by using Fox versus CNN and MSNBC versus the New York Times, Washington Post, USA Today, like it did look like it was kind of everybody's, but the quotes, they just sent the quotes to me, that it did seem a little bashy. So that was just my take on it. But
yeah, as a qualitative, I do qualitative research, so I guess
I
something
do
worth,
qual too, so I look at the quotes too. Yeah.
and so like a lot of thought goes into like what are the quotes that you pick to be the exemplary excerpts for the themes that come out. So if we even just look at these different themes that they pulled out in the different news sources that they had, I see a pattern of what news sources had the kind of rejection oriented themes. So like see the but there is, I mean, I feel like that's also reflective of like the media biases, right? Or lack of. So like the kids reject as Fox, goes too far as Fox. So I can see some alignment on that, and it's kind of like not surprising. But yeah, I don't think it was a kind of like explicit thing that the authors of this article outlined. So that's a good point.
Well, and it seems too like the base of the arguments, you know, like against government regulation and you know, seem to be and you know, local control versus federal control seem to be aligned with conservative arguments.
Yeah, I mean, I guess that's true. I didn't really think too much into it, I guess, because we do live in this, you know, two-party system. And so, you know, conservatives have a certain opinion about the engagement of government versus, liberals. And that's how it is, right? We don't really have other options. It's like this or that. So, okay, yeah, I just want to make sure I didn't miss some blatant political statement.
Yeah, I think, and I mean, I don't know how this was funded, but there might also be political issues of just the writing of this article and the way they're allowed to talk about political parties.
Yeah, when I saw the universities where the researchers were from, and then the state of Oregon, I thought that was a key indicator for me, because in my systems class I had the state of Oregon, and it's a very interesting population because the majority of the state is rural. So it's like, who's paying for that? It's so I look at so many other factors as in addition to the actual study, and it's like, what made them think? Because if you think about it, all the majority of the state is concentrated in Portland, just like here in Illinois. We're concentrated in Chicago, and the rest of the state is pretty much rural or red. So yeah, so many other pieces to the puzzle. I had so many mixed emotions about this article. So yeah, it wasn't, they were trying to stay even Stevens. So you were right, Patrick. It wasn't nothing to figure out. They was trying to play kind of both sides of the token to stay safe.
Did anyone else have a point to make? So I think LaShonda's question on Blackboard was, can the government distribute funding for specific programs and policies without really having a say in how the money is allocated? So i.e., we will grant you, the state, X amount of dollars for your initiative, and you may choose to disseminate it across the state. Can this be done?
I actually have an answer. Aha! The answer is technically yes, but not in the way you think. So there's an article, and also there's a term called street level bureaucrats. And street level bureaucrats are people like in these government offices, once the money is distributed, that make these determinations. So for instance, Medicaid expansion. I can't remember which one is which. Medicaid expansion, right? The states can pick up different options for what they're going to use it for. So some can pick up the option for PA services. There are people who do ones for rehab for food. Like in the state of Illinois, if you're disabled and you are trying to learn how to cook, you want to cook, the state has picked up that option to do that. But here it is, it's an option. So some states can not choose to pick up that option to have it covered, and some states can. Which brings me to my next point of street level bureaucrats. They're generally the people who deal with people in these offices that make these decisions. So if you're calling to apply for like TAN, SNAP, WIC, SSI, SSDI, they are the people who make the decisions about how the paperwork is processed, if it's processed. And that can be good or bad, right? Depending on the answers you give, depending on how you answer them, depending on how you look. That's another issue. I remember when I was living in South Shore, I applied for SNAP, and I wasn't working at the time because I just moved here. I just moved to Illinois, and I wasn't getting anybody in. And at first they were like, no, you have to be working. Like, unless there's a special circumstance, you have to be working or no. And I was like, well, I won't be working until next month. I got here, it was the middle of July. My contract technically starts the middle of the month. So at first the guy was like, no, these are the rules, I'm sorry. Then he called me back 2 hours later and said, well, actually I spoke to my supervisor, and what he said was, we can give you 1 month. Then when you start working, you have to report it. Right? So that's how I was able to get it. And then because I have a certain type of fellowship, and that is a different category of funding, I'm technically eligible. And it was just this weird, complicated thing. But initially it was just a no. It was a no. I got the thing. It was electronic. You've been rejected. Then he called me 2 hours later. It was like, nope, we were able to figure out a way. Right? And that person made the decision to continue to think about and help me and tell me the rules of how this all worked in Illinois. Because in Ohio, it was just like, no, we don't care if you're a student. We don't care. You don't fit this criteria. boom. Yeah, and a lot of people have been getting no for different relief things. I applied, and I'm not going to go into it, but like these people, these street level bureaucrats, they make the decisions about how things are spent, right? So even if the federal government eventually gets a rundown of what's being spent, the state makes decisions based on the money they get, and some states have unfortunately chosen to privatize a lot of medical things, but a lot of people have started dying because of it, because they're denying people services who normally would. A lot of disabled people, especially, they're saying, oh, you are now no longer severely disabled enough to get these services, or we're cutting these services, or you have to pay for certain services, or whereas before they would, right? So the states are making these decisions based on this kind of sum the government gives them to spend on these areas. They can say, okay, well, you said we need to spend this much money on COVID relief, right? And you gave us these broad guidelines, which depending on the program, the federal government will give semi-broad guidelines. We'll say this is COVID relief, this is COVID relief, and that's COVID relief. Another state will say, no, it's this and that and that. And so they will get to decide how that's being spent down the line. And then it trickles down to the street level bureaucrats. They get these set of rules, and in some ways they interpret them how they want to. Right? And depending on how you interact with them, that's how they will interpret them. And is that the right system? Of course not. But that is the current system when it comes to things. I'm going to see if I can find, there were a few articles. Was it? This kind of goes over, it gives a bit of an overview. But yeah, so that's kind of the term that's actually used when we talk about those decision-making processes. Yeah. Oh yeah, someone said, yeah, we saw what, some people do with, we're over time, I'm so sorry. If y'all want to say and talk about this more, we can. I took a policy class, that's kind of how I know the term and where it comes from. And so, yeah, and we can talk about other examples of how the state gets a certain amount of money and the way they spend it and how they choose to spend it, or how they choose to spend the money they get from the federal government is different. But those are two really good examples, like Medicaid, COVID relief. So yeah, I'm so glad you asked that question, because yeah,
Yeah, I mean,
it is a
I took
thing.
I took my policy class last semester, and being an MCH, all we know about the these block grants or whatever, but that's why I guess for this article I just kind of went both ways, because it's like, I just looked at it as the monetary source, like if especially the states that have like larger rural populations or tribal populations, their resources are very, very, very limited, and so hey, let's get a couple of coins from the government, but so yeah, we can give you this, and then y'all can kind of do whatever y'all need to do to fix what you need to fix. Like that's kind of why they still need to. I'm kind of lean go both ways, because the states still need to have their autonomy, which we in theory for the United States we do, but they still put some asterisks next to, if we give you $3 million, you got to have 35% be targeted towards white populations, or it's always some crazy demographic or whatever type of criteria that they put behind that. But for that particular question, I'm just thinking about, no, we just gonna give you this money. If the entire thing is a grant, and you kind of fix it, if it's targeted for a specific initiative, like if we're giving $3 million for nutrition policies for children in school or whatever, and then you do it whatever you wish. That was kind of the angle I was coming through with that question.
Yeah, I definitely see both sides too, because one good side is, now we have this kind of freedom to spend money on populations that were underserved. But then in, like, when you mentioned tribal populations, I'm like, can we get them running water and electricity? Because there's some that don't have electricity because it was legal not to give it to them. And now that you can't discriminate, they're like, yeah, but it's going to cost you like 30, 40,000 to run some electricity to your home, or like 30, 40,000, just like they said with the water, 30, 40,000 to run the water. And it's like, why should we have to pay for that? We didn't put ourselves on this reservation. Like, but yeah, so some states with tribal populations are not doing the greatest. But then also there are other states that are like, okay, this initiative will expand this for this cause, and we can help alleviate some strain on the local municipalities that can't support certain initiatives. So, yep.
I just wanted to chime in because I'm actually in health policy and administration. So this is kind of like what we do. So, you know, it really comes down to how we're set up constitutionally in our federalist society, where you have federal rights and state rights. And I think the biggest thing before COVID, you know, that kind of shows us is the rollout of the ACA and giving money for Medicaid expansion, keeping in mind that Medicaid is a federal state joint venture.
Yeah.
So it comes from both angles. And a lot of states that actually have populations who have poor health outcomes, and I'm thinking like the Deep South, like decided not to roll out Medicaid expansion. And so it's like the flip side, right, of LaShonda's point, like give the states the money, let them do what they want because you think it's better for a local kind of policymaking. But at the same time, it can reinforce systems of oppression, like all the old white people who run Mississippi government, you know, and decided not to expand Medicaid. And so Mississippi has the worst health outcomes in the country, right? And so it's like a core fundamental principle of the US government is this kind of division of powers and monies. So I think keeping that in mind, you have to always think twice, like when you advocate for one way or the other, because there's really no good answer, right? You could either have the federal government say you have to do this, or you hope that you live in a state that's going to do what you need or want, right?
Oh yeah, definitely. That's why I was like, it's such a hard decision to make because it's like both. It goes it's teeter-totter. You know, we talk a lot about Medicaid expansion, especially in MCH with birth outcomes. And so Mississippi, of course, the Bible Belt is the worst in the country. And you know, especially those are the ones that the non-Medicaid expansion states, and those are the ones that hit the higher COVID numbers. Those are the ones, you know, it's just like a domino effect with with all of that. So that's why I say it's just so hard to say if they can or can't, only because they got the money. They got the money, but but it's like they're not going to disseminate the way it needs to be, equitably, because we all know who needs the more resources, and we all, you know what I'm saying, whichever states have the highest disparities.
I think I was looking at what Mrs. Grant wrote about different approaches can work better depending on the specifics. And in higher education, this is something that we do too when we are advocating for particular policies. We compare ourselves with certain colleges. So an MSI, minority serving institution of a certain size in a certain region, this is a program they have, let's institute it. That is actually one of the ways in which we got, so there's something called CUFBA, College and University Food Bank Alliance. And Bowling Green State University didn't have a food bank. At the time, University of Toledo had one, then got rid of it, but then they brought it back. And then some other colleges in the area that are considered sort of competitors brought food banks back too. So that is because Bowling Green was relying on the churches to provide food bank assistance, and then one small mutual aid org. So they, because of the other colleges getting food banks together, found out, they were like, okay, we're going to do this now. We're going to do food banks. We're going to do mobile food pantries, because their contemporaries in the area that were similar to them were doing it too. That's how you sometimes got to get it done. All right. Ooh, 7:40. So yeah, I know y'all probably got to head out, but this was great. I can't wait till next week. Yes, the church is very much still a staple. I actually did my work, did a documentary in Mississippi, and the church is providing so much aid, so much care. There's a coalition of churches that actually help to reorganize the K through 12 system in Jackson, so that it's not like one person taking care of all these things. It's like more structured. So if something is happening, there are more people who can kind of manage that. They help to alleviate a food desert. They help someone start up a supermarket in a food desert, and they do a buy-in every month to support them. It's called Working Together Jackson. I'll actually put it. And they also have a really good disability policy that, I was able to join them for a meeting, and it was great. So that is definitely true. And that's definitely, again, a different policy to utilize. How do you utilize that as a way of having power and things like that in decision making? All right. Sorry, I've spoken a lot.
I think the Bible Belt still, I mean, when it comes to policy, you got to think about those cultural implications too,
Mhm.
because I got friends from the South, from the East Coast, and I mean, you know, just everyday behaviors and things are so different. Like they're, you know, even in Chicago, the West Side versus the South Side, you know, West Side ideologies are, you know, different from South Side, you know, in different places they experience different things. And I think when they're very family oriented down South, they're the faith is strong, whichever they, you know, and so the way policy, you know, that church and state thing is probably big down there, you know, so it's hard to, you know, differentiate, because even up here it that church and state thing got in the way when, I don't know if y'all remember when Reverend Meeks did the political thing. He had the big church Salem on the South Side, and then he went into the political realm and tried to go into the education part, and it kind of caused a little bit of friction in the Black community. It's like, why is he now going to the political side and he's been a man of the faith and the cloth? So it gets real fuzzy when you start crossing those invisible lines, especially for certain types of communities, when it comes to policy. And Corey Brooks, if y'all probably know, Corey Brooks is probably the big one that was on top of that building to get tore down across from his church. Like, he went the political route too with Ronner. So it just got real. The cultural thing is important too when it comes to that policy ain't my thing, but some stuff I do kind of understand. Look, you HPA people got a special talent.
All right. Thank you all. We're just gonna wrap up, and we'll see you all next week.
Yay, spring break is coming. Hang in there,
It
everyone.
is one more class and then break.